You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV. I'm your host, John Tassoni. My today's guest is Rich LeClerc, and Rich is a policy associate with the Substance Use Mental Health Leadership Council. And today we'll be talking about the new system that we're trying to get here in Rhode Island, CCBHC. Rich, welcome and thank you for joining us today.
John, nice to see you again. Thank you for inviting me. I appreciate it.
Rich, tell my viewers, what is CCBHC?
All right. I'll tell you, and if there's going to be a test at the end.
Okay, good.
Okay. CCBHC stands for Certified Community Behavioral Health Clinic.
Okay.
Okay, and all the acronyms there. So CCBHC, it's a lot easier to say that than Certified Community Behavioral Health Clinic. Can I go into a little bit what it stands
Certainly
for, what
may.
it does?
Certainly may.
It's an initiative out of the federal government that started around 2015, 2016, when the federal government, out of the Substance Abuse Mental Health Services Administration, put out an RFP for the states to plan and grant for mental health and addiction treatment in their communities, what they need, and then every state got $1 million, and they submitted a plan to the federal government. The federal government accepted 8 states, it's now 10, to be part of the CCBHC. And the states then certify organizations within their community, within their state, to live by the standards of CCBHC. And with that, they get a lot of federal money that comes in at the state level. So there's some guidelines for that, but it's ultimately going to help individuals access care. That's the main thing. So when you think 1 out of 5 people in Rhode Island have a mental health or addiction treatment, and only about 30% can get care, and so that would be a big improvement for Rhode Island. And we do have CCBHC in Rhode Island, but through a grant program, not through the demonstration pilot program. Grants are great, but they go away. So I also do work at Newport Mental Health Center, and they have 2 CCBHC grants that carry them over 4 years, but that's going to end. And so we're looking at making sure that the services that are provided by being certified as a CCBHC and providing the services, and I can go into that a little bit more in a few minutes if you want me to, what exactly that the organizations would provide. So with those services in place, we can improve care in Rhode Island for people with mental health or addiction treatment.
So there's been many questions, whether it be through the providers, the Leadership Council, and others. Access to care is a key component for people to stay into treatment. You can't make a call if you need to have overnight stay at a residential treatment facility and there's a 5-day wait. That doesn't help anybody. So why does the CCBHC work so well? Is it a continuum of care where all the ducks are in the row? Or do you have a duck swimming in a pond over here to the right and they're missing a piece of that care? Tell me about that.
So the obligation of an organization that's a CCBHC is to provide what they're called 9 essential services. So they'll break out into emergency services with standards, 15-minute response to an emergency, 12-hour response for urgent care. So there are standards that have to be measured in order to be able to be part of that. Mobile crisis, you go out and see people in their homes. So this is for mental health or addiction. A comprehensive outpatient treatment program, medication-assisted treatment program, co-occurring disorder treatment program, individual family counseling, use of evidence-based practices, not just any kind of practice that show that, requires targeted case management. It requires a whole host of services that need to be provided that will assure that if someone needs help, they get the help. Now, in some medical professions, you have an upset stomach, yes, you can wait on that. But a lot of times people that have an addiction issue or a mental health issue, they need the help right away. So you're going to be able to respond and do it in a mobile way that's accessible to them. So that would address that particular issue for in Rhode Island, at least, with the creation of CCBHC.
You know, I have a particular issue with the mobile crisis. Not an issue, but I wanted to talk about that because I think it's very imperative with our elderly folks that can't access a ride, can't access a bus line, especially in the outer focuses of Rhode Island, in the southern border, and in northern Rhode Island. How do you look at the mobile crisis and the response time to a crisis by a mobile unit? Is it where they just pull out of a garage and they get the phone call like a 911? How does that mobile crisis work?
Well, it's evolving in Rhode Island. So there is BH Link that provides a valuable service 24/7. It's limited to adults, and I think the mobile crisis capacity there is very limited. So during evening times, there may be limited ability to do mobile crisis, especially if it's a first call in a community that you're not familiar with. But during the day, during the evening, after hours with school with kids, each CCBHC needs to develop the capacity to visit people in their homes and respond. Or it's the homes at their senior center or in other community settings to be able to do that. That's the goal of that. The challenge is finding people who would do that kind of work.
Right.
We hear a lot in the news about what COVID has done to the workforce. People aren't being hired by restaurants or by the hospitality industry. Well, healthcare is affected severely. But that's been coming for the last 10 years or so, when lack of funding and lack of resources for providers in the community to help people of the community, people haven't chosen that as a career path. And so you can't turn that switch on right away. So the challenge for us who advocate for CCBHC is to be able to find the workforce, people that speak different languages, they're from different cultures, right, that understand the issues of the elderly, need to be cultivated and hired to make that work. We're doing the best we can now, but we've got to be able to take steps in that direction. So Newport Mental Health Center is a CCBHC with funding that's limited. Community treatment, community care affiliates is also on. Thrive Behavioral Health. We have East Bay CAP and now Family Service Society. So the state is receiving, or will receive by the end of this period, about $12-15 million to get us going in the way of CCBHC. Now we have to work on sustainability to make sure that we continue serving the people.
So we have, if in fact we do get sustainability, is there a savings to the state by going to CCBHC?
Everyone refers it to the return on investment. So
right.
Yes, there is. There are states that have been doing this since 2016. Missouri, Oklahoma, Utah, Minnesota. And what they find is the state saves money by minimizing the use of hospitalization. People don't need to go in the hospital anymore if someone's visiting them at their house, if their medication's being properly managed, if their symptoms are monitored, if they're hooked up with recovery services. That is seen as decreasing use of inpatient care and emergency room care. Also, decreasing homelessness, decreasing use of the correctional facilities. Other states have seen that significantly impact not giving. Granted, some other states have had a lot of opportunity for improvement. So Rhode Island can definitely benefit by that, by implementing the CCBHC and getting the savings. But you have to do an upfront investment. You got to hire the staff. You got to train the staff. You got to have systems in place. You have to be measuring your outcomes. You have to invest in those services.
Well, we have to invest too right now because we have to go to break. You're listening to Recovery TV. I'm your host, John Tassoni. We're here with Rich LeClerc, and we're right back after this.
Every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
With these,
And this.
with my mouth shut,
and my ears wide open.
it means that from the moment you walk into the room,
You're the most important patient to me.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Welcome back to Recovery TV. I'm your host, John Tassoni. My guest today is Rich LeClerc, and he is a policy associate at the Substance Use Mental Health Leadership Council and also does some work for the Newport Mental Health. Welcome, Rich, and thank you for joining us today.
Nice to be here, John.
You know, I wanted to address a couple of things with you after the first segment. The issue of addressing financial barriers, which is a big thing. We know, you and I know, a lot of our affiliates are having financial difficulties because of funding, financing, workforce issues. You can go to certain places, fast food places, and get $20 an hour, and we have master's degrees people making $16, $17 an hour. So the math doesn't work, and that's why I think we're in the crisis that we're in. So let's talk about financial barriers. I think CCBHC tightens the barriers. It makes it better for our providers. Tell me about that.
Yep. John, there are 2 kinds of financial barriers. The first kind, and I'll get to your question in a minute, pertains to people seeking help. So if you can't afford to pay, you don't have insurance, or your insurance has a huge copay, you say, I can't get the help, then you don't get the help, or you have a bill, and that becomes more stress and more of an issue. So CCBHC says organizations that are certified as CCBHCs have to take everybody, regardless of their ability to pay. There is a sliding scale fee, so if someone can pay $10 or whatever, they need to pay that. But it's a sliding scale fee, and the people served have to be served even if they're not from that community. So if they're driving through, or they're living there for a month with a family member or something, and they're in crisis, you can't say, oh, you don't live in our community, therefore we can't serve you. So geographic and financial barriers are addressed in CCBHC. What CCBHC does at the federal level is that the feds require that this be cost-based reimbursement. So a provider has to have certain costs associated with delivering the service. So some of it is staff, computers, mileage that they have to pay for, training that goes on. Those costs need to be reimbursed. So, I mean, who can argue against someone's costs not being addressed? Right. Otherwise, you start cutting back on services, you start cutting back on quality of care, and ultimately your community doesn't benefit by that. So CCBHC requires cost-based reimbursement. for those services. In the true model of CCBHC, according to the feds, if you have a contract with other providers, because earlier you asked me a question about certain services, it's very hard for one organization to provide the 6,000 services that are needed, but you have to provide core services, enough for the population. But you contract with other providers in your community that you are responsible for, but their costs get included in your rate, so you can then pay them what they need to hire the staff and do the training. And
It's almost like a team effort.
Yes.
A team effort.
Yeah.
You know, one of the things too, Rich, that we had talked about over the past, I don't know, 6 months that we've been talking about this, is that when people want to access care, even though financially it could be a burden to them, the hospitals get reimbursed from the state for uncompensated care. We don't. It's not fair. It's not fair. We should be put in the same category as the hospitals. We, the providers, like you said, we don't say, listen, you don't have insurance, we can't take you. We take you in. We take you under the wing. We provide services. That comes at a cost. That is a loss. You know, just like the hospitals. Yeah. It's a loss. But the hospitals get a piece of the pie. Yeah. All we get is what goes in the garbage disposal. We don't get what we deserve. And that seems to be a key component right now, because there's a lot of people that don't have the health care that we should all have. They don't have it. And some of the plans, as you indicated, $5,000, $3,000, $10,000 copays. That's huge now. I mean, the cost of health care has gone through the roof.
Yeah.
So how do we, as providers, fix it? How do we fix it? I mean, the CCBHC will help, obviously. It's not going to be a hindrance, but it's a help. And then what you indicated before, you get a 3-year, 5-year grant, and then all of a sudden that's gone. What's going to happen? What's going to happen to these poor people? What's going to happen to the companies?
Yeah.
Are they still going to be around? Are they going to be afford to stay around? What do you think?
It's a complex issue. And because in no other part of healthcare field do essential services get funded solely by grants. So if you have a heart attack and you're going to go to rehab, and you call rehab for an appointment, and they won't tell you, you know, that grant we had is running out, and we can't take you. Right. Maybe in a year or two, we'll go for another one, we'll take you then.
Right.
But you do that in mental health and addiction treatment. Oh, we don't have an opening. Oh, we have a waiting list. That's the main thing. We have a waiting list. So we don't say no, but we have a waiting list that's about 6 months if we can get to it, you know, that kind of thing. So it has to be a long-term public policy commitment on the part of the state and the federal government, and the federal government has made that commitment for 10 states. We're hoping to be the 11th state when they expand it, to be able to plan and deliver those services and invest in it. And then you see the benefits about healthier communities, less homelessness, less people in the correctional, less people in nursing homes, better quality of care in nursing homes, families that are struggling with trying to take care of older people with dementia at home or with behavioral health care issues. It's a tremendous burden. They need to go to work. They have kids that are being Zoomed at home through their education. They've got to be there. So the stress is unbelievable. And I think COVID has pointed out some areas and weaknesses in our support for people in their community, because that's what government is about. The safety and welfare of your community. Yeah. And so they've got to make that long-term investment in that and hold people accountable, hold providers accountable.
Yeah, you know, I mean, when we did the telehealth legislation this year, that's one of the key components to getting access to care, you know, and they finally realized that if you can stay out of the emergency room and have a conversation with a psychiatrist, or stay out of the emergency room and have a conversation with your primary care doc, we're saving money. We're saving money. Not only that, it's much easier to be on a computer today than it is to go to the hospitals and wait in emergency rooms, because the wait time there, it's a killer. It's a killer. By the time you get to see your doctor, you're stressed out, your blood pressure's through the roof, you don't know what's going to happen to you, and it's a family issue. It's a family issue.
Absolutely. I know one of the requirements of CCBHC is looking at telehealth. And so at Newport, we're looking at a plan for doing this over the next year or two. COVID happened, within 2 weeks you have telehealth. So it jump-started that. That's one of the benefits, I think, one of the few benefits that COVID did. It forced us to move towards that treatment. And you have more people showing up for appointments. You don't have to find childcare or drive or find transportation to your appointment. You can see your physician right there.
Great, thank you. You're listening to Recovery TV, and you're watching Recovery TV. This is the Voice of Hope. And my guest today is Rich LeClerc from the Newport Mental Health, and also a policy analyst for the Substance Use Mental Health Leadership Council, and we'll be right back after this.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services, and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. By quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
Welcome back to Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope. My guest today is Rich LeClerc. And Rich is with the Newport Mental Health Group and also a policy analyst for the Substance Use Mental Health Leadership Council. Again, Rich, thank you for joining us today. I know you're a busy guy.
Nice to be here, John.
And get through your schedule. So, Rich, I want to ask you one other question about CCBHC. How many states currently have it? I think you mentioned it before, but I'd like you to rehash that for me.
Sure. There are 10 states that's involved in the federal pilot where they get reimbursement on the Medicaid rate. That's a significant amount of money. Then there are grants given out to organizations. So there are CCBHCs in 43 states,
wow,
and there are over 500 CCBHCs in the country. Those that are in the pilot states probably consist of about 150. So the bulk of the CCBHC expansion is through those grants that are time limited. But what that has done is has shown that it's very popular throughout the country. It has huge bipartisan support in Congress, and that it's passed every single year. And there's a bill in now to allow any and all 50 states to be part of that particular demonstration pilot, where they get Rhode Island would get like $18 million if this was if they were selected as a pilot state. So as broad support, but we need to keep the momentum going.
I mean, Rhode Island's such a small state, the smallest state in the union. I wouldn't see why they could give us $18 million. It's only a drop in the bucket.
It's a rounding error, right?
But I also want to talk to you about the military. Does the military have a place in CCBHC?
Yeah, the veterans and the military and the collaboration with the Veterans Hospital is specifically mentioned in a standard of care for an organization that's a CCBHC. We need to have linkages and outreach to veterans. We need to have linkages with the Veterans Hospital, which Newport has. We have linkage with Operation Stand Down that provides housing and employment and financial assistance to veterans, and especially focusing on veterans that have severe illnesses. The VA does a great job providing care, but they can't provide the total care, so they look at working with us and treating veterans in the community and providing them with the services they need.
That's great news, Rich. Great news. You've been watching Recovery TV. I'm your host, John Tassoni. This is the Voice of Hope, and we'll see you next week.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You know, you can make it through this, you can get back on track.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated-assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated-assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.
Sunday mornings, join host John J. Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.